Shortly before he retired as the development director at the DMC, John Lohr began to experience fatigue and shortness of breath.
I was really having a lot of difficulty just walking, and really couldn't catch my breath. But I was attributing it to my age. I was 63 at the time. It was in 2005.
Physical exams, blood work, EKGs, and stress tests turned up nothing. So, John Lohr's colleagues at the DMC suggested he undergo the CT64 slice imaging test that yields a 3D look at the heart. His doctor, Pierre Atallah, who is director of coronary angiography at Harper University Hospital, explained the advantages of this non-invasive approach.
Take the shots at different moments where the heart is at rest, and then image the pictures and get quality that's very superior to be able to analyze it and diagnose disease without having to go and do cardiac catheterization, which is the traditional way we did these things, by going to the heart, putting catheters in there, and accessing the heart by invasion. There is no invasion here.
The patient simply lies on a table while an IV delivers dye to the area for contrast. Within a few minutes, the patient gets up and is dressed, and the doctor is looking at an image of the heart as though he could hold it in his hands.
We can just look at it in front of us. It's just like the surgeon being there and looking. My joke about it is that it'll take you longer to sign the consent, have the IV started, than to have the test. It's that simple.
The test revealed that John had a 90% blockage in the right coronary artery, a potentially life-threatening condition. Then, with minimally invasive surgery, a stent was implanted to open up that artery. And it all happened because of the life-saving data the 64 slice sent to a workstation for the doctor to view.
We see 0.5 millimeter at a time, so how much can you miss?
You eliminate all guessing.
There's no guessing. When we tell somebody your CT angiogram of the heart is normal, the chances for us to be wrong are 0.
Since this coronary CTA, or 64 slice, can provide evidence of early disease, it has proven especially valuable in patients with mild or no symptoms, but who are at risk for coronary artery disease.
If you take patients with coronary artery blockages, severe or moderate blockages,
Right.
only 30% of these patients will ever have a symptom of chest discomfort or pain. 60 to 70%, the first symptom is sudden cardiac death or a heart attack. It even gets more difficult if they are female patients. Female patients might never experience chest pain. Actually, studies have shown that the most common symptom of heart disease in women is fatigue. This is the tool that will tell us what is causing the symptoms.
Like many patients, John Lohr did not experience chest pain, so he considers the 64 slice a miracle of sorts.
The staff here was outstanding, the care was incredible, and the aftercare was absolutely outstanding. So it's been a miracle for me, it really has.
Visit us anytime at dmc.org to learn more about 64 slice imaging or to make an appointment with Dr. Pierre Atallah and the fine team at Harper University Hospital. The DMC. We just think it's a better way to get better. I'm Emery King.